We have with us today Mrs. Edna Kearney. Mrs. Kearney is 75 years old. She's been a patient of mine for 10 years, and she's been on testosterone replacement for exactly 2 years. So what was going on prior to the beginning of the testosterone replacement? Let's start with your strength and energy and things like that.
Well, I felt tired most of the time. I would go to bed tired, I would get up tired. I just didn't seem to have any energy.
Yeah.
Although I kept going, because I know that's what I had to do.
How long had that been going on?
It seemed to start, maybe about a year before I started on the testosterone. About a year.
Is that when it first started or when it became more severe?
Well, I would say when it became more severe.
And you had told me that you really began to feel some fatigue about 10 years before that.
Yeah, some fatigue, but
not too bad.
I paid too much attention.
So it really became a problem for you a year before we made the diagnosis of testosterone deficiency.
Yes, yes.
And physical strength, had you noticed any loss of that?
Yes, some.
Some, okay. What about any psychological problems, mental things? Was anything there going on?
Sometimes I would get nervous. So I would have these, I would say nervous tension attacks sometime, once in a while. For no, I didn't see for no reason, but I would just get these nervous, jittery feeling.
How often would that happen?
It usually happened about once a month.
And how long had that been going on?
Well, that had been going on, I say about maybe a year before I started taking the testosterone.
These nervous attacks and the fatigue, did they seem to be getting worse before you started the testosterone?
Yeah, they seemed to be getting worse. It would happen more often. The nervous attacks would happen more often. And the fatigue was getting worse.
And also sexually. How were you sexually at that time?
Well, I wasn't sexually active at all.
And you had no sexual thoughts?
No.
It didn't exist?
No, it didn't, no.
And it didn't bother you?
It didn't bother me.
Didn't exist, it wasn't there, it was all over with?
Right.
Okay. And one more thing to talk about is that you actually had a mild case of angina at that time. You were having chest pain from your heart.
Yes.
And that had been going on for how long?
That had been going on, let me see, must have been about, I've been your patient 10 years. Oh, it must have been about 2 years before I was your patient.
Okay.
When I had the first angina attack, which I didn't know what it was. I thought.
But actually, by the time you started the testosterone replacement, it was 10 years.
Yes.
Okay. But these were never very severe or frequent.
No.
Looking through your records, you would have like it maybe once, twice, 3 times a year.
Yes.
Would be a mild angina attack.
Yes.
And that had seemed pretty stable.
Yes.
Yeah. Okay. So, because of your complaints of this worsening fatigue, we did a testosterone level on you. It came back very low. And in December of 2006, we started you on testosterone replacement therapy. And what happened? What happened with the strength and the energy?
It started going up. I started feeling much better. The energy, the strength, I had the energy to do what I had to do without stopping to sit down to rest. And my strength seemed to be coming back. And I was having less angina attacks. I started having less, and now I don't have any.
How long has it been since you had an angina attack?
Well, I had, let's see, did I have one? I believe it was the end of last year, the end of 2007, I believe.
So it's been a whole year without any angina.
Without any angina attack.
I remember you telling me that before the testosterone, when you went up a flight of steps, you had to only go about 3 or 4 steps and then stop to rest.
Yes.
And then now?
I can go up a flight of steps
with no problem?
with no problems. Once I get up the flight of steps, I'll be a little breathless, and I stop and rest. But the point is, I can get up the flight of steps.
Okay. And what about the mental part of your problems? The nervousness?
That's completely gone. I don't feel that. I don't get nervous anymore.
Zero.
Zero. The nervousness is disappeared.
You also mentioned something about your feelings of self-confidence and self-esteem.
Oh, that came up. That's through the roof now. My self-esteem and confidence
Is
way up. And I say this through the roof.
that's good.
That's good.
That's good. And how long would you say you'd had a problem with a lack of self-esteem and a lack of self-confidence? How long had that been going on?
Good, going on forever.
Your whole life?
Yes.
So you're really in your face now when you want to be.
That's right.
Do you think it's excessive?
No, I don't think it's excessive. I think it's just where I should be.
Okay. And no angina now for actually looking in your chart, it was a little bit over a year. More like about 15 months that you've had any angina.
Yes, I don't have any.
So, and oh yeah, what about your sexuality? Did that change?
Yes, my sexuality changed. I thought about sex, had sexual desires, and I take care of it.
So this
And
is
that's good.
a new thing in your life
That's a
that
new
came
thing.
back.
That came back.
And that's good.
That's good.
Very good?
Very good.
Okay. Well, thank you for letting us know about all of this. I'm sure it'll be very helpful. Thanks a lot, Edna.
You're welcome.